Did you know that by the time you finish watching this video, around 20 seniors will have been diagnosed with dementia? That's one every few seconds. But here's the terrifying part. What if the cause isn't aging, but something lurking in your medicine cabinet? You've been told these pills are safe, routine, even essential. But new research is sounding the alarm. An astonishing 99% of seniors have no idea that at least one medication they retaking could shrink key memory centers in the brain.
How?
Let that sink in. The pharmaceutical industry has known about this for decades, yet they profit billions from selling the very drugs that may be accelerating cognitive decline. A recent study found one class of drugs increased dementia risk by nearly 50% in seniors within just 2 years. In this video, we'll reveal the 9 most dangerous medications triggering rapid memory loss, ranked from commonly ignored to mind-destroying. And number 3, it's prescribed $2 million for something seemingly harmless, but it can silently shrink your brain's memory centers. Before we dive in, let me know in the comments, what medications are you taking daily? And have you ever felt sudden brain fog or forgetfulness? We're reading every comment and replying. Your story could help someone else. Don't stay silent. This could save your mind. Now, let's start with number 9. Don't let its position fool you. This one is in almost every senior's home, and it might be scrambling your brain before you even feel it. Number 9 is diphenhydramine, commonly known as Benadryl. It's that pink pill millions trust to help them sleep, soothe allergies, or ease cold symptoms. It's cheap over the counter, and you probably have it in your nightstand right now. You might think you're just taking it to sleep better. But inside your brain, Benadryl could be disrupting your hippocampus, the region responsible for storing new memories. Benadryl is an anticholinergic drug, which means it blocks a key neurotransmitter called acetylcholine. This chemical messenger is crucial for your brain to form new memories and stay alert. As your brain ages, it relies on every bit of acetylcholine it has. When a drug like Benadryl interferes, the result can be devastating. A recent study found that seniors who used these drugs regularly had a significantly higher risk of developing dementia. So how do you protect your memory? First, be cautious of anything with diphenhydramine, especially if it's labeled PM, nighttime, or allergy relief. These are often Benadryl in disguise. If you're using it for allergies, consider newer, non-sedating options like loratadine, which don't cross the blood-brain barrier and are much safer for long-term use. Never stop a medication abruptly without talking to your doctor. Also, never assume that over-the-counter means risk-free. Now, let's move on to number 8. This one is often prescribed for anxiety or sleep, and it's become one of the most widely used medications in the world. But its long-term effects on your brain are far from relaxing. It belongs to a class of drugs called benzodiazepines, and you'll know them by names like Xanax, Valium, and Ativan. Doctors prescribe them to help calm anxiety or as a short-term sleep aid. The problem is, many people end up taking them for years. These drugs work by enhancing the effect of a neurotransmitter called GABA, which slows down brain activity. This is what makes you feel calm. However, long-term use can lead to dependency and, more alarmingly, cognitive impairment. Studies have shown that prolonged use of benzodiazepines is linked to a higher risk of dementia. Think of it like constantly putting the brakes on your brain. Over time, the braking system can get stuck, making it harder for your brain to speed back up when you need it to think clearly and form memories. If you're taking one of these medications, it's absolutely critical to talk with your doctor about a plan to slowly and safely taper off, if appropriate for your condition. Suddenly stopping can be dangerous. If you're managing anxiety or sleep issues, explore alternatives like cognitive behavioral therapy, mindfulness, or melatonin, which can be effective without the cognitive risks. Coming up at number 7, we have a medication taken by millions to manage pain. It's available over the counter and is often seen as a safer alternative to other painkillers. But new evidence suggests it might be quietly damaging your brain's processing power. I'm talking about certain non-steroidal anti-inflammatory drugs, or NSAIDs, specifically drugs like ibuprofen, sold as Advil or Motrin. Let's talk about a medication often sold as being harmless and gentle on your stomach. The surprising truth is it can actually interfere with the very nutrients your brain needs to stay sharp. This is medication number 8, proton pump inhibitors. You might know them as Prilosec or Nexium. These drugs belong to a class called proton pump inhibitors, or PPIs. They're designed to reduce stomach acid, and are often prescribed for heartburn, GERD, and acid reflux. Many seniors end up staying on them for years, even decades, because their symptoms come right back as soon as they stop. But what's rarely discussed is how PP has blocked the absorption of vitamin B12, a crucial nutrient that protects the brain and supports memory, focus, and mood stability. A 2016 study in JAMA Neurology looked at over 73,000 people aged 75 and older. It found that regular PPI users had a 44% increased risk of developing dementia compared to non-users. That's a huge number. By suppressing stomach acid too aggressively, PPs don't just interfere with B12, but also with magnesium and calcium. These are essential for neural transmission and brain cell signaling. Without them, your neurons struggle to fire efficiently, which can cause misfiring, confusion, and memory lapses that often look just like the early signs of Alzheimer's disease. But the problem goes even deeper. PPs have also been shown to increase levels of amyloid beta plaques in the brain. These are toxic proteins that disrupt brain function and are considered a core driver of Alzheimer's disease. The good news is that there are safer alternatives. If you're using a PPI every day, ask your doctor if you can slowly taper off with the help of H2 blockers like famotidine, which is sold under the name Pepcid. While they aren't perfect, H2 blockers are less likely to interfere with your cognition. Also, chewing a bit of deglycerinated licorice, which is a natural compound that coats and soothes the stomach lining, can offer symptom relief without the cognitive harm. Next up is a medication often taken for bladder control, but it might be wreaking havoc on both your short-term memory and your emotional balance. This is medication number 7, bladder control medications. Oxybutynin, sold under the brand name Ditropon, is often prescribed to seniors who struggle with urinary incontinence or an overactive bladder. On the surface, it seems like a practical solution. Nobody wants to deal with the embarrassment or inconvenience of frequent bathroom trips. But this medication works by blocking acetylcholine, which is the same brain chemical that's disrupted by Benadryl. And unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier more easily and directly affects memory regions in the hippocampus. This makes it particularly dangerous for seniors, especially when it's used over long periods. In a 2019 study published in the BMJ, researchers found that people over 65 who took strong medications like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That's nearly 1 in 2. What makes this even more concerning is that many seniors are never warned about these cognitive side effects. They're simply told it will help with bladder control, not that it may accelerate their mental decline. The harm is often just mistaken for normal aging. It's so important to be aware of what you're retaking and to have open conversations with your doctor about the potential risks and safer alternatives. Lots of people feel foggy, forget appointments, misplace items, or suddenly struggle to keep up with conversations. It's rarely linked back to medication until the damage has really progressed. So if you're taking oxybutynin and you've noticed any mental changes, it's not just in your head, and you don't have to stay on that drug to stay in control. Fortunately, there are newer medications like mirabegron, sold as Myrbetriq, that work through a different mechanism and have shown significantly less impact on memory. These drugs don't block acetylcholine and are generally considered safer for older adults. Coming in at number 6, statins. Statins are some of the most widely prescribed drugs in the world, especially for people over 60. They were meant to lower cholesterol and reduce the risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold as Zocor and Lipitor, are the two most common ones. But here's where the problem starts. Cholesterol isn't just a heart issue, it's a brain necessity. The brain is made up of nearly 60% fat. Cholesterol plays a key role in creating and maintaining the myelin sheath, which is a protective coating that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you may also be starving the brain of what it needs to function. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment, and those on high doses had even more noticeable declines. What's even more concerning is that some patients reported sudden onset memory loss, describing moments where they couldn't recall names, recent conversations, or even familiar driving routes. Now, it's important to understand that not all statins affect the brain equally. Some, like pravastatin and rosuvastatin, don't cross the blood-brain barrier as easily and are considered less risky for cognitive side effects. If you've been on a statin for years and you're noticing fog, forgetfulness, or confusion, it might be time to talk with your doctor about a dose reduction or an alternative strategy. Don't wait until it becomes irreversible. The earlier you take action, the better your chance of protecting your mind for the years to come. Next up, number 5, benzodiazepines. Benzodiazepines, which include drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are some of the most widely prescribed medications for anxiety and sleep problems. They work by enhancing GABA, the brain's calming chemical that reduces overstimulation. At first, they seem like lifesavers. They quiet the mind, ease panic, and help with sleep. But over time, these drugs become something else entirely, a trap. A 2022 study in the BMJ followed over 8,000 seniors for 6 years and found that those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk went even higher for long-acting benzos like diazepam, which stay in the body longer and accumulate in fatty tissues, including the brain. Quiet. What happens is a kind of chemical sedation that slows neural activity. That means your brain stops learning as quickly. It becomes less flexible, less efficient, and more prone to confusion, memory gaps, and emotional dullness. Seniors on benzos often describe feeling like they're in a fog, disconnected, or just not themselves. And the worst part is when they try to stop. Withdrawal symptoms like anxiety, agitation, and insomnia can be severe, making the drug feel essential when it's actually the source of the problem. If you've been on a benzo for more than a few weeks, do not stop suddenly. This can be dangerous. Instead, work closely with a doctor to taper the dose gradually. Alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety can help restore calm without causing memory loss. At number 4, we have amitriptyline, or Elavil. Amitriptyline is an older antidepressant that's still commonly prescribed today for pain, insomnia, and sometimes even migraines. At first glance, it may seem like a multi-use miracle pill, but under the surface, it's one of the most potent anticholinergic medications still in circulation. This means it blocks the action of acetylcholine, the chemical that helps neurons communicate. Today, we're tackling a critically important topic: medications that can mimic or accelerate dementia in older adults. It's a hidden danger many families face without even realizing it. So, let's get right into it, starting with a surprisingly common antidepressant, This medication is different from its SSRI siblings like sertraline or escitalopram. In a large 2021 review published in Frontiers in Psychiatry, researchers found that elderly patients taking paroxetine showed measurable declines in short-term memory, verbal recall, and attention span within just the first year. The study also found that seniors on paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The irony is that it's often prescribed to stabilize mood, yet it can end up undermining mental clarity over time. The fix here is straightforward. The American Geriatric Society has placed paroxetine on its Beers criteria list, which identifies medications potentially inappropriate for older adults. If you or a loved one is on it, talk to your doctor about switching to safer alternatives like sertraline or escitalopram, which are better tolerated and don't carry the same cognitive risks. Next up, antipsychotics. This one is especially alarming because many seniors don't even know they're taking them. Drugs like quizapine, risperidone, and olanzapine were originally developed for schizophrenia and bipolar disorder. But today, they're frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia. The consequences can be devastating. Study in The Lancet, Healthy Longevity, found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months. These drugs also increase the risk of stroke, falls, and severe sedation. They work by suppressing dopamine, a chemical critical for executive function and memory. This is why seniors on these drugs can appear dull, emotionally flat, or zombified. Correcting this starts with asking tough questions. If you or a loved one is on one of these medications, ask the doctor why it was prescribed and if it's truly necessary. Often, behavioral symptoms can be managed with non-drug approaches, like creating structured routines, reducing overstimulation, and addressing pain. When medication is needed, lower doses for shorter periods can reduce harm. Finally, the number one hidden danger that almost no one talks about is polypharmacy. You might expect a single drug to top this list, but the biggest contributor to drug-induced dementia is actually the interaction of multiple medications. We'll dive deep into this in our next video, so make sure you're subscribed so you don't miss it. Thanks for watching.